Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo. I'm here with my freshly minted Back to School podcast host, Dr. J. Calvert. How are
time.
you? You look like you're like a boy on his way to his first day of school. Your hair's all freshly cut. You have your new uniform on. You're like ready. You're ready to go to school.
I actually put on clothing today.
You did.
I know.
And you look very spiffy.
No jammies. I always love that I can wear scrubs to work. And today I felt that I should look the part since we're doing some podcasts and just gotta spiff it up a little bit. I gotta keep up with you.
You just have to get dressed.
I did.
Some days you just have to put on real clothes.
And this is the back to school episode.
This is back to school. Because you know what? We're coming up on Labor Day. We are officially wrapping up the summer. The mornings, the evenings are getting cooler. Here in California, I just came back from Texas. They are not getting cooler over there. But here in California, things are starting to cool down a little bit. And the kids are back in school. They're all heading back to college, heading back to school. And so we sort of want to wrap up the summertime and start planning our fall plastic surgery bonanza.
And that bonanza is coming because
during the summer, patients out there, they're going on vacation, they're traveling, they're doing stuff with the kids, and the sun's out, they're not coming in and getting their lasers, and they don't want to have plastic surgery and wear post-op garments and be out of the pools. So, things definitely calm down in the summertime. And then once Labor Day comes, it's like, whoo, back on track.
When am I getting my facelift?
The kids are back in school. I'm free.
Yep. There's definitely that. And it's true. You have to kind of plan it out because I can't tell you how many people come in right before Thanksgiving and are like, I'm ready for my facelift first or second week of December. I was like, okay, next year then?
Yeah, you and everyone else.
Because I talked to everybody who's having facelifts in December starting back in April.
Yeah, and that is 100% true. So this podcast is about planning when and what kind of surgeries you should have now that the summer of fun is over. We're all getting back to work, getting serious, about everything, and it's time to get serious about your plastic surgery plans. So everyone that I have seen in the past couple weeks, I've had so many of them tell me, well, I want to have my surgery around the holidays or November, December. And I'm like, put yourself on the schedule now, because if you come back in 2 months saying you're ready, those times are going to be gone. Because guess what? You and everyone else has the same plan. So if you know that you're serious about wanting to have plastic surgery before the end of the year, especially within one of those holiday time frames, now is the time to put yourself on the books.
For sure. There's
or you can pay the extra premium for a Saturday surgery.
That was a wise choice by you to do that. I think that's I'm going to follow that lead because I can't operate on Saturdays anymore.
It's so
I just
hard,
can't.
But towards the end of the year, you run out of OR days, and so sometimes we add on a Saturday for an uptick in cost.
Yeah, I get it.
It's
I know because it's not normal and it's your weekend. You're burning. It's and people will pay it because they get it.
They want
they do
surgery
they want it. But I think that right now it's that time where go to the mirror. Take a look. It's time for a dose of honesty, people.
Yeah.
You got to swallow hard and just go, okay.
Those mimosas were really fun.
It's time. I'm getting lipo. I'm getting my face done. It's time. And the rhinoplasty thing too. I obviously I do a lot of noses, but the kids that I'm operating in December have already come in. They've been in for their consults.
Right.
They booked their surgeries because I do about 20 rhinoplasties in December. There was one December I did 33 rhinoplasties.
Jeez.
That was a lot. And and plus I still have my smattering of 5, 6, 7 facelifts. And that does tend to uptick in December because people have time off, and that's when they want to do it. So what we're saying is call up, book it now, or the time, because I know my December already has a bunch of stuff in it already, and it's not. It's never good when you have to tell people you have to wait till January, and they do. By the way, my January is usually busy with the overflow from stuff from December. But if you're a patient and you're sitting there thinking it's time, well, it's never too soon to get the consultation. And this is just a public service announcement from your friendly plastic surgeons. Then you don't want to get skunked on the OR times because it's limited. It is.
It's a limited, commodity for sure. And there's no right or wrong surgery to do at any given time of the year. It's very dependent on, you and your practices and your family and your job and what's going on in your life. But I have noticed that faces tend to uptick a little bit during this time period. I'm not sure why. And I tend to be a little bit more busier with breast and body stuff, like come the new year, kind of February, March, because people are gearing up for summertime.
They're eyeballing summer and going like, I need this belly gun.
I need some work done. And the whole new year, new you thing happens. But I do see that faces especially get a little bit more prominent during this time of the year. But then I also have a bunch of patients that are like, you know what? I don't want to be wearing garments and post-operative things and kind of staying bundled up in the hot spring or summer months. So they do preferentially prefer to do their body work, especially during this colder time of the year, because then they can bundle up in garments and, put on leggings and it works. They're not, wanting to be free in sundresses.
Yeah. I mean, it just depends on, I do all these operations all the time, all year long. People are like, what time of year is best for this? I was like,
anytime.
When you want to do it, basically. Yeah. I mean, there's no like weather advantage in California. Like the weather here is amazing. So like, there's a reason we put up with these taxes and the things that we put up with to live. I'm going to not get up on that soapbox this very minute. I'll stay down right here. Seated. I'm seated. I am firmly planted with, I'm cool.
Okay.
But yes, we pay all this to be here because the weather is amazing. You can do things anytime. And plastic surgery, and there, I had an interesting conversation today with another doctor. We're taking care of a patient together, and we were talking about things. And she said, well, this person went here for this, and it looks terrible, and they went there for that. She goes, I don't understand why people leave Southern California to have plastic surgery. She looked me in the eye and just said, we have the best plastic surgeons in the world here. Like she was like, and she was not joking. Like she was serious as a heart attack. Like how stupid are these people that they clean? Like I'm like, I don't know. I can't tell you that. I mean, I think price is one reason people go shopping for plastic surgery elsewhere. Don't you think?
Price is a big reason.
It's very expensive.
And there are very, very, very skilled, talented plastic surgeons
Definitely, all over the world.
All over the world. We are not unique to having excellent plastic surgeons. But if you already live here.
But that was her point. She's like, wait, you live here. She's like, there are some good plastic surgeons here. Like, I don't know if anybody's looked around.
Yeah.
And I always tell people that. I said, look, if you're in Beverly Hills talking to people that do rhinoplasty, whether I do it or, one of my colleagues, you're going to get a good rhinoplasty. Like, we know what we're doing here. And it is, and there are good rhinoplasty surgeons everywhere. But again, if you live here and you're trying to like,
yeah, we're here.
Fly to whatever. But it's price. I think price is
definitely a thing. I mean, that's why plastic surgery in Turkey has such a following and a movement, because it's a lot cheaper to go there. No, you don't always know what you're going to, we'll save that for another podcast. You don't always know what you're going to get, but it's definitely cheaper.
Yeah, I mean, I will say that my friends in Turkey that are of my level that do rhinoplasty are not cheaper. They are.
Okay.
They are not. I know that I'm not going to name names, but my friend who's on a lot of panels with me and a lot of meetings all the time, his revision rhinoplasties with a rib graft are like €25,000.
But people probably aren't going to him because if they're going to Turkey from the United States, they're going for
they're going for the ads. Yeah, they're going for the cheaper ads of the people that are working for the government, basically.
Yeah.
And that's a whole
different podcast. The Turkey podcast.
I can pull back the curtain on that one, but I'm not sure anybody wants to look. So that is it. Maybe that's why people leave is price. But if you're sitting here and you're a Southern Californian and you're thinking about plastic surgery in this fall or the winter, now's the time to go get your consultation. Look at the before and after photos. Look at the social media profiles. Whatever it is that it takes for you to figure out, who's your go-to. And then, you should get an idea of pricing, because pricing is variable. Like our neighborhood's expensive.
So that's where if you have that one plastic surgeon you really want to go to and you're set and all your friends went to them and they're great, go to that person. But if you know that you're the kind of person that wants to do a couple of like opinions or one or two different surgeons, then you need time to do that. So start planning those different consults or visits now so you can get an idea and not feel rushed about it. And then you kind of have to look about the whole holistic picture, like we talk about all the time, your plastic surgery plan. If you want to have a facelift, but you're thinking about you want to get your skin ready for it, you've been out in the sun all summer and you have some sun damage and some sunspots, thoughts. Like, how are you going to do that? Are you going to work on getting your lasers before your facelift? Are you going to do your lasers after your facelift? There definitely is a time course to these things. And going in and talking with your plastic surgeon and getting their opinion is very helpful, because as we are spending less time in the sun, this is now when the laser procedures really tick up. You can't do lasers as much in the summertime because sun exposure and lasers don't go well together. But, if you're getting to a part of the year and part of the world where you're seeing less sun, now's the time to start incorporating those lasers into your plastic surgery plan.
Yeah, definitely the laser thing kicks up hard starting right after Labor Day because, the sun's...
I already have mine booked. I'm like, next weekend I have an appointment with the IPL machine. Because I'm not going to be seeing any sun after Labor Day, I can guarantee you.
I know how you do. You're going to come in and look like you just came from the burn unit.
Not that I see sun anyways.
No, it's true. I mean, we have the OR tan.
Yeah, but it's just, you just got to plan. You got to have a plan.
So hopefully this is helpful for everyone. But, any specifics that you would tell the folks that are, say they're thinking about a facelift, like anything that they need to know right now that's new and improved in terms of facelifts that they got to think about before they go in there?
New and improved? Probably not. Just go in and get your consult. Make your plan. Get your lasers. Do everything you need to do. Get your timing set up that you want. If you want to come back from Thanksgiving or from Christmas just looking so refreshed. You just spent a couple weeks in the Alps, and this is just how I glow now.
Yeah.
Other than that, I got a facelift.
A lot of people, when things go well, like I have a lot of people that come in and say, I'm not going to tell anybody, I'm going to do this. And then when it goes well, they literally can't talk to anybody without telling them how awesome it is. Oh my gosh,
it's so true.
It's so
I know.
true.
My last facelift patient was like that. She was like, I'm telling everybody about it. This is the person who was like, I don't want any photos taken.
I don't want anybody to know.
No.
And then
now she's like telling everybody.
They all do. It's
because they're excited. They want to share their excitement.
And they want to show like, hey, this really look what this did for me. Like, and they feel confident and they're not afraid to share, which is too, it's too cool. It's really awesome for, I always like when my patients win. It's great.
Yeah. Yeah. And I think, we talked about doing the planning for if you want to do your vacation time. But the other thing to think about, and I have some patients that are looking at this now, is if you know that you're going to be having a lot of holiday parties, in December that you want to be prepared for, then you kind of need to start thinking about doing your procedures at least 6 weeks before you want to get out in public and start doing a lot of events and parties. So that kind of pushes your timeline back a little bit earlier, so September, October-ish. By the way, it's September, which is like crazy to me.
Right.
Like
it's here.
Wasn't it just New Year's?
I know.
So these are all things to think about. Think about your life. Think about what's coming up. Do you want to have your downtime over the holidays, or do you want to be like holiday party ready and just plan accordingly?
One of our patients today was like, I want to do this in November. I was like, that's in 8 weeks.
By the way.
November's like...
I know.
That's here.
I know.
This goes very quickly from here to the end of the year. And
yeah.
You just kind of gotta have that on your site. So, once again, we're here to help.
We're here to help.
That's why we're giving this public service announcement to book your plastic surgery.
We're so helpful with our plastic surgery public service announcements. Right. Don't get fake Botox and plan your plastic surgery.
Yeah, I think it's very good. Well, anything else you want to pop into this discussion before we vamos out of this one?
Nope. Summer's over, people. Time to get serious. Time to get serious about your plastic surgery.
That sounds very good.
Yeah. Well, I think that's it. So get your plastic surgery plans on. And this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.